Stanford Youth Solutions has been a long-time mental health provider, founded early on as an orphanage, but in the 90s and 2000, we really discovered or revealed that we really needed to provide more mental health services for children. And our mission really began to focus on supporting children in homes as opposed to supporting children in congregate care settings. So Stanford really focused on those high need children with a lot of mental health challenges, and supporting them and families, strengthening everybody's skills so that they can successfully live in a home and in the community. Sierra was founded as an adoption agency in 1983, and their commitment was really permanency for all children that came through their doors in the form of adoption. And in the 2000s, Stanford and Sierra started working together on permanency plans for those children that were identified as hard to place. So we had a partnership before the merger, but with the continuum of care reform, we had made a stronger commitment to partner together. And in 2018 began to speak about a merger opportunity to provide a broader base of care, mental health support services, treatment for trauma, work with attachment for young people with families, and permanency, whether it be adoption or family reunification or kin family placements. And so it made a lot of sense to merge both organizations into one, and now we're called Stanford Sierra Youth and Families. So Stanford Sierra Youth and Families redeveloped our strategic plan. It's a 3-year strategic plan focused on 5 pillars. There's services, people, infrastructure, impact, and innovation. And then under each of those pillars, we have some very specific strategic initiatives. I am not going to go into all the detail. There's too many strategic initiatives, but there are focused areas where we really want the highest quality services and services that meet the needs of our community and families, and attend to the gaps in services that exist. We want people that are engaged in the work, our staff, our families, and also volunteers and our board members. We want sound infrastructure with where we're prepared for growth and opportunities to expand our services, and we have a sustainable infrastructure so we can weather difficult times. We want impact, meaning that what we do makes a difference in the community and that people know and understand the work we do. So our outcomes are published and we talk about what we do in the community, and we also support other organizations in creating great outcomes and delivering better results. And then the innovation is our newest pillar. And innovation is about trying new things, giving opportunities to do things that maybe have never been done before or have been done in another organization in another part of the country or world. And we know that they have worked there, and we bring it here to address a gap in the system. But also innovation is larger than that. It's about reshaping the system in general at both the local and the state level and even nationally. Youth and families receive services in different modalities or different ways based on the program. So if you're speaking of our Pathways to Permanency program, the youth are referred, the foster youth are referred into our homes. We find family homes, and then we train up our families to support the young people. Simultaneously, we work with the birth family with visits, supervised visitation, and supports to facilitate reunification. If that can't happen, then we support our foster homes in either opening their home for adoption or supporting a young person in the transition into an adoptive home. And we will actually do very specific family matching and family recruitment based on a child through our Destination Family program. We also provide mental health services across several counties in the Sacramento region. And those young people are referred through the county systems of care. And our social workers, clinicians, case managers, basically take a look at the referral and then match that young person to the appropriate clinician. And it's pretty consistent across all of the counties we serve that those young people are referred through the county system. But with our probation children, through juvenile justice intervention services, those young people are referred through the probation department. We also have some other services like family and youth partnership support, where either families that have been with us can continue to get support services through our support groups, and young people can continue after services to participate in our youth leadership programs.